Hi, I'm Dr. Rocco Piazza, board certified plastic surgeon. This is Dr. Melissa Cady, board certified anesthesiologist and pain medicine physician. Today I am introducing you to her because we create exceptional anesthesia and surgical experiences together. I can't do it alone, and I do it with Dr. Cady. And that's because she believes wholeheartedly in having a relationship with our patients. She's going to tell you a little bit about her process and what that's like from a patient perspective.
Absolutely. So once you've scheduled for surgery, I'll get information to be able to contact you, and then I will send you a text so we can schedule a time for a Zoom video meeting, and we'll actually schedule that within 2 weeks before surgery is typically the time frame. And then we'll get to meet and talk about your medical issues and then go through the play-by-play, so to speak.
What's so exceptional is that Dr. Cady is going to actually learn about your history ahead of time. Create a plan to make sure that your experience is nothing less than exceptional. And she's going to explain her philosophy on anesthesia. And she creates this customized plan with you ahead of time so she's not winging it the morning of surgery. She knows you, you know her, there's no mask. And it's like, are you kidding me? This is amazing, right? And I think that is like one of the biggest things that is so special about our anesthesia experience together. I think that is what makes us so special, is that we put in all this work to make sure patients' concerns are answered, anxieties are lessened, fears and myths about anesthesia dispelled, and get to know them, each patient, as a unique individual. And I say this all the time, like, our patients are our only variable. I know you, you know me, we know Heather, we all work together. Paul too, our circulating nurse, and that's our team. And the only person we don't really know as well as each other is our patient, and it should be the only variable. Not who's staffing the room, not who's putting the patient under anesthesia. That's what creates exceptional experiences and exceptional outcomes.
I agree. So it's interesting, when I talk to patients during a Zoom interview, it just really captures the essence of anxiety that happens when you start describing the step-by-step process and informing them of what the process will be that day. So if I was to do it the day of surgery and I start doing that, I start seeing their eyes widen. You can tell the anxiety is like real. It becomes real and gets them nervous. And so if I can do that outside of the environment of the surgery center right before they go back, if I can talk to them in the Zoom meeting, then they're able to kind of process that, and then they can reach back out to me if they thought of another question later by a text to me. I find that patients start feeling that anxiety, like what you see in the surgery center the day of. You'll see it in their face the moment you start talking, even on a Zoom meeting. So you can see that they're starting, and I'll even ask them, I'll stop, and I say, are you starting to feel nervous? And they'll be, yes, it's starting to feel real. So I get that a lot from patients. So when you start talking about the details, that's where the nervousness comes in. But if you can get them to process that early and then answer questions later, because then they can process that, then it makes it a lot better, excuse me, for the patient when they come the day up. We don't even have to talk about any of that. There's just so much going on in your head when you show up for surgery. And I always go through, even during my Zoom meetings, I talk to them about when I sense that anxiety and stress, I'll help them understand that they're in an unusual environment. It's not uncommon to start suddenly feeling this anxiety, suddenly feel like your GI system is going crazy, and you can't get control over that. But I tell them your body is just there to protect you. So your subconscious, whether you're trying to control it or not, it's picking up on all these cues. Your subconscious knows this may not be a safe environment just because you're not familiar with it. Even though you trust the people you are going to be cared for, it's not unusual for your system to kind of get revved up. So I actually talk to some of my patients during Zoom meetings about that kind of experience, and to bring their phone to keep themselves distracted and remain connected to the people they love. And then slow, deep breaths, which is easy to tell mothers of children because they know that slow, deep breaths help them during moments of anxiety or pain, or any kind of stress. So those are kind of things that I enjoy talking to my patients about.
Yeah, and I think you really are spot on. If we can really help manage some of this anxiety before surgery, 1 to 2 weeks prior to surgery, and it makes that day go even easier. Patients know what to expect. We know after working together for nearly 8-9 years that patients when they bring a lot of anxiety to the surgical experience, it changes their parameters, their heart rate, their blood pressure. We know that. So our goal as a team is to really lessen that on the front end, empower our patients with knowledge and education so they understand what they're going to be experiencing and that it's normal to feel certain feelings as we're headed down the surgical journey.
Right, and I think I'm always fascinated by that whole process with understanding the patient and they're human beings, but we all are comprised of nervous systems, and I'm fascinated by the variety of nervous systems and how we respond to stress. And so it's when you can help patients feel safe, and a lot of my background in the pain world has helped me understand a lot of these elements to us as human beings, is that if you can help people feel safe, and there's different ways that people do that, then you really help them on the front end. And when they come to me to have surgery, in the anesthesia world, yes, the heart rate and the blood pressure, you're bringing me a nervous system. And you're a human being, but you're bringing me a nervous system that I have to interact with medications to keep you safe. And so the more calm your system can be when it comes to me is usually best to undergo surgery.
So kind of recap a little bit about our experience together and the process we created. Dr. Cady does primarily these things when she meets with our patients ahead of time, and that is review your medical history, make sure she understands you from a whole health perspective. She likes to meet your spouse or significant other, whoever your biggest supporter is, so bring them to your Zoom meeting. She's going to explain her philosophy on anesthesia care, and she's going to explain the risks around anesthesia in general, which actually are quite low. When we look at healthy individuals undergoing anesthesia, it is a minuscule risk to having an adverse event. And then lastly, she's going to create a customized plan for you so that you feel safe and that you know exactly what's going to happen that day of surgery. And I think that is what makes us an outlier and takes us to the next level when it comes to patient care and surgical experiences.